you have event, you have experience, and you have effects. Okay, in trauma, it can be a single event or multiple events. Alright, and then the threat is there. The physical, psychological threat is there. It can be in single event and or multiple events. The way you experience trauma would be different from individual to another individual. That's why experience is a whole lot of things that are going on there, but it doesn't mean that what I went through would be the same as what you went through. Okay? And the last E is effects. As you can see there, it has multiple effects. You have cognitive, physiological, you have biological. All these are going to affect you in different aspects. So those are the 3 E's of trauma. Are we good? Okay, next you have acute, you have chronic, and you have complex. So looking at the definition itself, if you say acute, it's immediate. Okay, once you are exposed to a certain threat, or traumatic event, you would feel, it says there, you might be a victim of crime, natural disaster, or a serious accident. So there's immediate effect. But what's the difference between acute and chronic? Chronic is prolonged. That's the key word for chronic. The experience of trauma is prolonged. For example, if that person is experiencing domestic violence or going through a war, that is chronic. But what makes chronic different from complex? As you can see there, it's multi-layered. What do you think multi-layered means? Yes, it has different layers, but what does it mean? Any idea? Can you give me, anyone can give me an example of complex? What makes it complex? Anyone? Keyword is there already. It happens particularly in childhood. Anyone? Alright, it's prolonged, but it's multi-layered means it happened multiple times. So these people are usually the ones who are abused in a very, very young age. And the abuse continues until they become adult. Okay, let's say, for example, this child has been sexually abused, but once he or she becomes an adult, she is also exposed to another type of abuse. Okay, so that becomes complex. Are we clear? Okay, yes, moving on. So this is what happens. This is the response. How your body and your mind responds to trauma. How does it react to trauma? So as you can see on the diagram, you have the thinking brain and also the emotional brain. Alright, I'm not saying you have 2 types of brain, no. Okay, it's just the function. You have your neocortex here, the outer layer of your brain, and in the middle you have the limbic. I'm pretty sure you're familiar with this, correct? You have the limbic system, which is in charge of? In charge of what? Limbic system. Emotion regulation, or anything about emotion. In that limbic system, we also have amygdala. Correct? Amygdala is in charge of fear response. Now what happens when traumatic event, continues to happen in that particular moment? So just think of like a switch, a light switch. Alright, thinking brain would interpret, okay, this is an alarm, this is a threat. So what happens next? What happens next? Once your thinking brain has perceived there is a traumatic event going on, what happens? Yes, very good. Yeah, the fight or flight response will be activated. So the thinking brain will say, emotional brain, this is your job. Okay, you need to activate the fight or flight response. Okay, so the fight or flight response will do its job, and then it will come back to its natural state. Relax. Alright? Rest and relax. So the thinking brain will say, okay, this is the time to stop sending signals that there is a threat. But what happens if a traumatic experience, continues. So as you can see there, it won't stop sending signals. It's always switched on. Okay? So imagine, I want you to do this. Do this. Put your thumb inside. And do this. Imagine that this outer layer of your hand is the neocortex. When trauma happens, this is kept open. So your limbic system is exposed. Do you understand? Alright? So because this part, the neocortex, is supposed to protect the limbic system. But it does not work. Are we good? Yeah? Okay, moving on. So these are the common, There's a whole lot of reactions or effects in different aspects when people are exposed to trauma. So as you can see there are different aspects. You have physical, you have emotional, cognitive, behavioral. I'm only naming a few because there's a lot of it. Alright, and also spiritual faith or faith. So physical, as you can see, you have the normal physiological response if you are scared or threatened. So you have elevated heart rate, your sugar will go up, you have gastrointestinal issues, and then you have, for emotional, sadness, anxiety, all that. Okay, what else? Okay, I want to touch on feeling a lack of involvement, enjoyment. So we call that anhedonia. Right, Dr. Ben? Anhedonia. Anhedonia is losing your interest in doing something that you like. You used to like doing something, but it doesn't have any, you don't feel it anymore. Okay? And then for cognitive, you have nightmares, recurring dreams, difficulty in memory, in concentrating, all that. For behavioral, what is family challenges? Any idea what that means? What is family challenges? You will have interpersonal problems. So you start being angry towards your loved ones. Alright? And then you have some people, they would engage into self-harming, for example. Self-harming here does not only mean cutting. Alright? Self-harming means taking something that is debilitating to your health. So example, substance abuse. Okay, and then you have, you push people out as well. Alright? So you also avoid places that remind you of the traumatic event. And lastly, some people, they question. They question their faith. It is not abnormal. Right? It is normal for people to actually question. Question their faith, question their belief. Why is this happening to me? All that. Alright, are we good? Moving on. So that is the part of trauma. I will move on to grief. We need to normalize grief. It's a normal emotional response. Okay, remember that. And it says here, no limits. What does that mean? What does it mean by no limits? What does it mean by no limits?
You don't need an end time.
There's no, I want you to write this down, please. There's no expiry date for grieving. Okay? No expiry date. You don't say, after a month, after a year, I'll be done. No. And people grieve differently, and you don't put an expiry date on that. Okay, some people, they've lost their family members, the husband, the wife, the child for about 20 years, but whenever they look at that picture, they still get very, very emotional. Are we clear? No rules. There's no rule in grieving. You don't say to another person, this is how you should grieve. No. There's no rules in grieving. People grieve, again, differently and uniquely. Alright? And then it says there, grief involves emotional pain that I said. Yeah, different people grieve differently, and the emotional effects are also very, very much different. And of course, as I mentioned earlier on, the same thing with trauma. Yeah, it has multiple effects. Spiritual, cognitive, behavioral, and all that. Are we good? Alright, moving on. So these are different types of grief. As you can see, again, there's a lot there. I'm going to touch just a little bit on a few, yeah? The first one, it says anticipatory. From the name itself, what is anticipate? What does anticipate mean? Anticipate. You're waiting, right? You're anticipating for something to happen. So if a person has been diagnosed with terminal illness, or the person is terminally ill, it can be you, it can be your loved ones. So it's anticipated. The grief is anticipated. You know, one day that person will leave you, example. Alright? And then you have this enfranchised grief. Any idea what that means? Or can you give me an example? It says there, grief that goes unrecognized. Why do you think it's unrecognized by society? It is seen as what? Sorry? Not common? It is actually quite common, but people see it or perceive it as what? Taboo or trivial, not so much to talk about. So give me an example. What kind of grief is that? Any idea?
Wanting to cut off a person?
Wanting to cut off a relationship. Break up, for example. Right? People see it very trivial. You know, trivial, right? Okay, it's something that is not really significant. Unless, okay, you're married to the person, then that's a different thing. But breakups between partners, or I'll give you another one good example. If you lose miscarriage, if you lose a baby. Okay, some people make it like, you're gonna get another one. That's not helpful at all. A life is still a life. Okay? And then what else? Traumatic grief, that's pretty much self-explanatory. You have cumulative. Again, you've suffered one loss and then continue with another loss. So let's say COVID-19, that a lot of people have actually perished or lost their lives. First, someone lost their husband, and then the kids, for example. Okay, that is definitely very, very traumatic. And then you have the rest. I will share the slides later on. Okay? Can we move on to the next slide? So these are basically, again, some symptoms that people would have when people are grieving. So again, these responses are very, very much normal. Very normal. Okay? I'm not going to go through again because it is something relevant, or it is something related to the traumatic experiences now. Okay? Can we move on? Okay, this is a grief reaction. So as you can see on your left, right, there is a loss, and then what happens next? Shock and denial, and then you have protest. You're angry, right? You're angry, you have strong emotions, you're so sad, okay, you're scared, all those are happening. And then disorientation or safeguarding. What is disorientation? Or what does it feel like when you are disoriented?
No sense of direction.
Sorry? Yes, you lose control, no sense of direction, you don't feel like yourself, you cannot think straight, all those are happening. Okay? And then of course you have feeling that you are going crazy because you are losing yourself. Correct? And then there comes the part of you're tired of feeling that you're going crazy. You come into terms with your loss. So acceptance. And then trying to adjust or resolution. Take note, this is an ideal. Why I say ideal? This is what people think how grief looks like. But actually it's like that. It's not a linear direction or just one direction. It goes ups and down. Up and down, up and down. So healing is never easy. Okay, it's never a straight line. You can always go back to zero. Are we good? Have that kind of understanding. Yes, can we move on to the next slide? Okay, these are the 5 R's. Again, this is very, very simple. This is not actually going to give you some ideas on how to do session or therapy, no, because you are still in the learning process, which I believe you will learn later on in details, okay? So these are the 5 R's of managing your trauma, yours. We start with yourself first. So what Dr. Dina has mentioned just now, you need to start with yourself first. So how to manage your own trauma and how to manage your own traumatic experience. Again, I'm talking about not the immediate threat. Yeah, we're not talking about fight or flight response, but once trauma has happened. Are we good? Yeah? Okay, the first one, recognize. Recognize what? Your triggers. What are your internal and external triggers? Okay? Internal means what is happening inside your body. Right? Physiological response, your thinking. External, what reminds you, what is happening around you that reminds you of that traumatic experience or your grief. Are we good? That's the first one, recognize. And then, respond. How do you respond to those triggers? Take note, I wrote there, acknowledge. Acknowledge what? Acknowledge whatever that is happening in the recognizing stage. Acknowledge the physiological changes, acknowledge the cognitive, acknowledge the behavior, all those. And then try to, I know it's not easy, yeah? It's not easy to accept that something is happening and you're feeling all these kinds of emotion. It's very overwhelming. But by accepting it, it's actually gonna give you what? The chance to empathize. Empathize to yourself. Empathize what is happening with you. Then only you do some rituals. What is rituals? Any, yeah, I wrote there, any activities that makes you calm. What is suitable for you? What makes you feel suited? Yeah. So it says there also something meaningful, because you can just we can do it right now. We'll just Google, find out what are the things that you can do when you are grieving. There's a lot, isn't it? But not everything can be suitable and meaningful. So find which suits you. Are we good? Yeah? And then referral. So what is referral? As you can see there, use your own judgment to decide, okay, can I handle this on my own or not? How to decide? You see that picture there? That is actually a pain scale. I borrowed it from, it is actually a scale that we give for chronic pain patients to ask what level of intensity of the pain that they're experiencing. So the same thing with whatever traumatic experience you're going through, whatever that you're feeling inside, from the scale of 1 to 10, how much does it affect you? Understood? If it is 5, look at 5, look at number 5. It is very distressing, correct? So yes, yeah. So if you say that I'm quoting Dr. Jordan Peterson. He mentioned this in his video. He said, "Do not be a thief." You know a thief, right? Thief takes people's belongings and properties. Meaning what? You take people's problem and make it as if your own. So when you do that, you are actually what? Is it good? Definitely not, because you are actually leaving them not only dependent on you, but also what? You're not giving them a chance to actually solve their own problem. Are we good? Yeah, take note of that. And then, of course, as you can see there, as I mentioned before, these are the signs or indications. If they need help, please observe those signs. Yeah. Okay, moving on. Next slide.